Good morning. It's June 8th and this is your daily brief in science. Here's everything you need to know. Artemis missions carry a real MMOD risk as micrometeoroids and meteor storms cruise at high speeds, threatening heat-resistant tiles on the Orion capsule and crew safety during Earth re-entry. NASA continually monitors the micrometeoroid environment and debris, with high-severity storms capable of delaying launches or forcing crews to stay protected inside the spacecraft. Protective strategies extend beyond Artemis. Space observatories like Hubble and Webb use dynamic positioning to shield optics, illustrating broad risk management practices in space operations. Historical precedents show NASA has postponed missions to avoid meteor storms, underscoring safety-driven launch scheduling. Forecasting and risk assessments are ongoing, with plans to delay or modify operations during significant meteor activity to safeguard crew and mission success. Current guidelines support delaying missions or adjusting crew protection when meteor activity is predicted, with forecasts of meteor storms available years in advance. Lunar mission protection focuses on shielding, material design balance, and potential mission parameter changes in response to meteor activity. Mitigation practices are established. JWST and Hubble rotate orientations to avoid meteor showers, illustrating proactive MMOD risk management. The Artemis context fits within a broader MMOD risk framework, emphasizing precaution as NASA pursues a sustained lunar presence. Orion and Artemis incorporate MMOD protection through material choices, thickness optimization, and hypervelocity impact testing. Forecasts foresee 4 meteor outbursts in the next decade, which could delay Artemis 4 if a storm coincides with launch or activities. A new approach to the Cerrado's fire management is gaining ground. Indigenous knowledge paired with scientific methods to reduce high-risk wildfires. The program recognizes fire as a natural and useful part of the landscape, and it supports a move away from the old zero-fire rule toward controlled burns guided by both tradition and data. It funds training and equipment for up to 40 Indigenous brigades across 5 states with support from the Bunge Foundation and IBAMA, expanding prevention responsibilities in communities. Experts say that when applied with expertise, fire aids conservation and land management, presenting a two-wing approach that combines Indigenous know-how with science. Planned burns rely on satellite data and local ecological knowledge to create fire breaks that protect villages, headwaters, and sensitive sites during the August-September drought. The operation starts with joint planning using satellite imagery and traditional knowledge to map burns, employing Cerrado workers in 2-year terms and volunteers in a community-led supervised model. The project emphasizes knowledge exchange, weaving elders' insights with government strategies as 2 wings needed for navigation and disaster prevention. Traditional methods like drip torches and dry palm leaves are blended with government aerial incendiary spheres to quickly intervene and mark a patchwork of burned areas that shield communities and ecosystems. Burn operations run as coordinated days of action between officials and Indigenous brigades, incorporating ceremonial and cultural elements that stress mutual respect and collaboration. Cerrado communities in Tocantins coordinate with IBAMA to conduct planned burns in the pre-dry season to prevent larger wildfires and reduce El Niño impacts. Heightened fire risk tied to El Niño conditions underscores the need for coordinated fire management across government and Indigenous groups, with anticipation that the droughts will intensify, making integrated management essential for the Cerrado and Amazon regions. A new set of Phase 3 results on Survodutide is drawing attention for MASLD and related liver disease. The synchronized MASLD trial met its co-primary endpoints over 48 weeks, with a substantial majority achieving meaningful liver fat reduction and a notable portion normalizing liver fat, reinforcing Survodutide's potential in MASLD. In the same program, Boehringer-Ingelheim's Survodutide showed strong fat loss effects, including large reductions in visceral fat and liver fat, while lean mass loss remained limited at the highest dose, indicating fat-driven weight loss and improved metabolic health. The Synchronize-1 study, involving 725 adults without type 2 diabetes, tested weekly doses of 3.6 milligrams or 6.0 milligrams against placebo over 76 weeks, with primary endpoints including percentage weight change and a high threshold for weight loss achievement. Survodutide remains investigational and is not approved. It carries several regulatory designations such as FDA Breakthrough Therapy and Fast Track, with EMA Prime designation and breakthrough designations in China and Taiwan. Global Phase 3 programs, LIVERAGE and LIVERAGE cirrhosis, are evaluating survodutide in MASLD-related fibrosis at advanced stages, signaling broadening trials in MASLD-related liver disease. The drug is licensed from Zealand Pharma to Boehringer Ingelheim, which leads global development and commercialization. Zealand stands to royalties and milestone payments totaling up to mid to high single digits and up to €185 million. Positive Phase 3 results from Synchronize-1 and Synchronize-MASLD were presented at major conferences and published in NEJM and Nature Medicine, underscoring robust data for survodutide. The releases contextualize MSL-MASH epidemiology and emphasize the growing need for treatments that address visceral and liver fat and overall metabolic health. Safety aligns with GLP-1-based therapies, with gastrointestinal events being the most common adverse effects and discontinuation around 19% at higher doses, but no new safety signals. Beyond weight loss, survodutide aims to improve metabolic health by addressing visceral and liver fat, inflammation, and fibrosis, with outlines for future trials and global development plans. The program combines GLP-1-mediated appetite suppression with glucagon-driven hepatic fat reduction, aiming to treat obesity-related metabolic dysfunction and liver fat accumulation across broader populations. The message reiterates that survodutide is investigational, with safety profiles consistent with GLP-1 therapies and similar discontinuation rates at higher doses. A multi-year international study finds that about 10% of people carry PAM gene variants linked to GLP-1 resistance, reducing the effectiveness of GLP-1 receptor agonists like Ozempic for lowering blood sugar in type 2 diabetes. Stanford medicine researchers published in Genome Medicine identify a genetic reason for why roughly 1 in 10 patients respond poorly to GLP-1 therapies, with implications for diabetes and obesity treatment. UT Southwestern and the Texas Diabetes Institute are positioned to translate PAM findings into practice as part of broader precision medicine efforts. Clinically, the findings suggest reevaluating prescribing and monitoring strategies and considering alternatives such as SGLT2 inhibitors or higher-dose tirzepatide for non-responders instead of continuing ineffective GLP-1 therapy. Testing for PAM variants could become a precision medicine tool to identify non-responders early, though pharmacogenomic testing is not yet standard care. 2 longer-acting GLP-1 receptor agonists showed different results, implying formulation and duration of action may influence responsiveness in PAM variant carriers. Weight loss data were inconclusive due to limited trial data, and more research is needed to understand how GLP-1 resistance affects weight outcomes. Researchers emphasize that genetic data from trials could explain varied responses and inform strategies to overcome GLP-1 resistance, including insulin sensitizers or alternative formulations. Carriers of PAM variants, notably P.S539W and P.D563G, have higher circulating GLP-1 but weaker signaling, leading to reduced drug efficacy. In PAM variant carriers, higher GLP-1 levels do not translate to stronger glucose control, indicating true pharmacogenomic non-responsiveness. Clinical trial data show that PAM variant carriers achieved HbA1c targets less often after 6 months of GLP-1-based therapy, 11.5% for P.S539W and 18.5% for P.D563G, versus about 25% in non-carriers, with no impact on responses to other diabetes meds. Approximately 33 million Americans carry PAM variants with higher prevalence among people with type 2 diabetes, suggesting regional and demographic disparities in GLP-1 drug effectiveness. A new approach to heat management in high-power transistors could change how multi-material chips perform. MIT and collaborators have embedded ultra-thin diamond interposers to keep the silicon/GaN stack at the same temperature, using diamond's superior thermal conductivity to spread heat. Diamond emerges as the standout material for this task, enabling GaN and silicon to run at uniform temperatures, which reduces parasitic effects and improves performance and reliability in 3D chip stacks. With heat evenly distributed, the transistors experience lower unwanted capacitances and better overall device behavior. The work, presented at the IEEE Symposium, involves MIT researchers Tomas Palacios, Ruanan Han, and Pradyut Yadav, with Georgia Tech and Penn State as collaborators. Lead author Yadav and colleagues spearheaded the effort, supported by ongoing multi-institution collaboration and funding from DoD entities, the Air Force OSR, MIT's Soldier Nanotechnologies Initiative, and Qualcomm Fellowships. This research builds on prior heterogeneously integrated GaN-on-silicon/glass approaches and directly tackles thermal reliability challenges crucial for scaling 3D systems and broadening wireless and energy-efficient applications. Fabrication uses femtosecond laser microstructuring to carve cavities in diamond, place GaN diodes, attach a die-attach film, and stack dielectric and metal layers, with surface preparation critical for heat flow. The process involves precise placement of GaN diodes into diamond cavities, followed by controlled bonding and layering to form a functioning circuit. The interposer approach avoids prior issues of added capacitances seen in diamond on GaN layers, delivering better performance without sacrificing reliability. The resulting power amplifier demonstrates higher output power, efficiency, and gain than comparable devices, signaling strong potential for 6G, satellite and space communications, high-power radars, and data center power management. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.